It can come without warning. A sharp pain, a heavy sensation, or just a vague discomfort in the middle of your chest, and immediately your mind begins to race with a flood of questions. Is this a heart attack, or is it just from last night's dinner? Should I be worried, or am I just overreacting? This uncertainty, the fine line between a medical emergency and a minor issue, is the root of the fear. It can lead to two equally dangerous outcomes: ignoring a deadly warning sign because you assume it's not serious, or living in constant anxiety over completely benign symptoms. This article is designed to be your detailed guide in that situation. We will not get sidetracked. Instead, this is an in-depth guide that gets straight to the point, focusing entirely on a single goal: to equip you with the core knowledge to clearly distinguish between a potentially life-threatening chest pain and one from other common causes. Let's decode these important signals together. To be able to differentiate, first of all, we need to clearly understand the portrait of the most dangerous enemy chest pain from a myocardial infarction. This is not a common pain. It is a collection of warning signals that the body sends out when a part of the heart muscle is being damaged due to lack of blood. Forget the image of a sharp stabbing pain like a knife that you often see in movies. The typical sensation of a heart attack is pressure. It is often described as a feeling of being weighed down, like a boulder or a very heavy object is pressing on the middle of the chest. A feeling of being squeezed or tightened, like an invisible hand is clenching your heart, or a rope is being tightened around the ribcage. A feeling of fullness discomfort. A tense, uncomfortable feeling deep inside, not on the surface of the skin. The pain can start at a mild level and then gradually increase in intensity or strike fiercely from the very beginning. The core thing to remember is it is a diffuse feeling of pressure, not a sharp pain at one point. The pain usually starts in the center of the chest behind the breastbone. It is a diffuse, vague pain. You would find it hard to use one finger to point exactly to the painful spot. But its most valuable identifying characteristic is the radiation. The pain doesn't stay in one place, but travels along typical pathways. Radiating to the shoulder, usually the left, traveling down the inner side of the left arm, sometimes the right arm, or both. Radiating to the neck and lower jaw, and then radiating straight to the back, the area between the shoulder blades. If you feel pressure in the chest, accompanied by a feeling of pain, numbness, or discomfort in any of the locations mentioned above, that is an extremely serious red alert. A heart attack is never just a local problem in the chest. It is an event that shocks the whole body. Therefore, the pain is often accompanied by one or more escorting symptoms. A cold sweat, you suddenly sweat a lot abnormally while the skin is cold and moist. Shortness of breath. A feeling of not being able to get enough air, having to struggle to breathe even while sitting still. Dizziness or lightheadedness. A feeling that your head is spinning, you are unsteady, or even about to faint. Nausea or vomiting. A queasy, uncomfortable feeling in the stomach. Heart-related pain is often very stubborn, lasting continuously for over 15 to 20 minutes. It is not a fleeting pain that lasts a few seconds and then disappears. More importantly, it does not get better when you change your posture, walk around, or sit down to rest. If your pain remains exactly the same even after you've sat down to rest, that is a very worrisome sign. The important thing to know is that not everyone experiences a classic heart attack as described above. Some groups of people may have very different symptoms that are easy to overlook. This is especially true for women, older adults over 75, and diabetic patients. In these groups, chest pain may be very mild or even absent. Instead, their main symptoms may be a sudden and extreme unexplained fatigue, shortness of breath as the most prominent sign. Pain in other locations, such as the back shoulders, upper abdomen, or jaw. Persistent nausea and indigestion. Recognizing these atypical signs is extremely important in order not to miss the golden time for emergency care. Besides cardiac causes, chest pain can also originate from many other common issues. Understanding these characteristics will help you assess the situation more calmly. One of the leading causes of confusion is the digestive system, especially acid reflux or heartburn. This pain has a burning sensation behind the breastbone, and it often occurs after a large meal spicy food or when lying down. It may be accompanied by a sour taste in the mouth and often lessens noticeably when you sit up or take antacid medications. Chest pain can also come from your chest wall itself, including muscles, bones, and cartilage. This type of pain often feels sharp stabbing and is localized to a very specific spot that you can point to with a finger. The most important identifying sign is that the pain increases when you press on that spot with your hand or when you perform movements like twisting, coughing, sneezing, or taking a deep breath. This is a clear differentiating characteristic from heart attack pain, which is deep inside and is not affected by these actions. Additionally, respiratory or psychological issues can also cause chest pain. Pain from the lungs, such as pleurisy, is often sharp and becomes much worse with each breath. Meanwhile, a panic attack can cause a feeling of chest pain accompanied by a racing heart and shortness of breath, but it usually lacks the typical radiation to the arm and jaw of a classic heart attack. To differentiate more clearly, let's directly compare the opposing characteristics of these two types of chest pain. Regarding dangerous chest pain from the heart, its main sensation is not a sharp pain, but rather a feeling of pressure, squeezing, or tightening in the middle of the chest. This pain is often diffuse, not in one specific spot, and has the important characteristic of radiating to other areas, such as the shoulder, left arm, neck, and jaw. In terms of duration, it lasts continuously for over 15 minutes and does not get better at all, even if you rest or change position. Finally, it is often accompanied by alarming systemic signs, such as a cold sweat, shortness of breath, dizziness, or nausea. In contrast, chest pain from other common causes often has a burning sensation like heartburn or a sharp stabbing pain like a needle prick. It is usually localized to a very specific spot that you can point to, and importantly, it does not radiate to other places like heart-related pain does. Another major difference is that this pain often depends on external factors. It will worsen when you cough, take a deep breath, or press on the painful spot. The pain can also lessen noticeably when you take antacids or change your position. And instead of systemic symptoms, it might be accompanied by heartburn or acid regurgitation if the cause is from the stomach. We have gone through the detailed characteristics to differentiate between a dangerous chest pain and a common one. The goal of this knowledge is to give you a clearer perspective to lessen panic and to help you recognize the warning signals your body is sending. However, the most important thing must be repeated. This information is not intended to replace a professional medical diagnosis. The human body is incredibly complex, and sometimes symptoms may not be entirely typical. Therefore, there is a golden rule, a single most important and unchanging piece of advice. When you have any doubt, seek immediate medical help. This means calling for an ambulance or going immediately to the nearest medical facility without hesitation. Think about the balance of risks. If you ignore a real heart attack, the consequences could be permanent heart damage or even death. Conversely, if you get it checked out and discover it's only heartburn, the biggest loss might just be a little bit of time and embarrassment. Clearly, choosing safety is always the wisest decision. Knowledge helps you to be calmer and to recognize the warning signs, but the right and timely action is what ultimately saves your life.